Hi, my name's Deb Taylor and I'm the Clinic Director at NatMed. As a functional medicine specialist, I was finding that I was spending a huge amount of my consultation time helping parents talk about what to put in their kids' lunch boxes when I all of a sudden told them that gluten wasn't their child's best friend. Or teaching a patient with cancer how to abstain from foods that were going to trigger insulin, which is a problem for oncostatic load or cancer patients. And so to remedy this situation, I brought in one of my team members who was in fourth year naturopathy, and we developed the food coaching model at NatMed. The idea with food coaching services is so that you can access support at a lower fee structure to enable you to comply with the food plan that your physiology is needing right now to heal. So, Dem, you've been doing food coaching for patients for a while.
Mm-hmm.
Can you give me an example of a patient that you've really enjoyed coaching, and what was the food plan that you did and what were the outcomes, and how did you leverage that patient's outcomes through your food coaching service?
Yeah, so essentially what you said before about, they'll meet with their functional medicine practitioner and sort of come up with the best way for them to be eating to, meet their health goals. So essentially, meeting with me, it's a very individualised approach. So I will, interview the patient and find out about what they're currently eating, and then I sort of marry that with what they the best way that they should be eating for them. So kind of merging those two together to make sure that they're eating the right things, but also that's going to be easy for them to implement. That's the hardest thing we find at the moment is, time and skills, and there's so much information about food and nutrition out there, it is a little bit overwhelming. So really just kind of making it simple. Seeing patients, and if it is, for example, gluten, talking to them about, the best ways to, eat a healthy gluten-free lifestyle and, strategies that they can do. There's lots of barriers that people face with food and nutrition, and especially for patients that are, really low in energy and don't have time to cook or just don't know where to look at the supermarket. So we kind of cover everything really. But like I said, the personalised approach is based on the client and what they need, whether they need a very strict 14-day meal plan or whether it's, a 7-day meal plan with lots of recipes and kind of links and suggestions that way. It's just really beneficial for the patient because they feel that they can, once they get their plan, they can kind of take that on board and kind of start making changes straight away. And it really kind of fits into their current, lifestyle, I guess. So it's just nice and easy and doesn't add too much stress.
So can you give me an example of someone that you've helped and the outcomes?
I couldn't try and think of somebody. So obviously seeing lots of different patients, there's different aspects, I guess, that are helpful. I've seen a patient recently and the biggest thing for her was, she was going through, she had an autoimmune condition. So we were looking at eliminating some inflammatory foods and looking at reducing her gluten and dairy intake was probably the biggest things for her. So what we did is really sat down and found out what her challenges were and why she loved having, dairy so much and what she was sort of having that with. So we really went through and, found some alternatives for them and looked at her favourite recipes and suggesting how we can swap that dairy out. So provided a 14-day meal plan for her, and speaking to them recently, they've come back and they've really taken a lot on board and made lots of changes. So, and I think last time I spoke with them, their the compliance was pretty high. I think there was still a few points in time where they've introduced a few things that were on the no list, but we're all human, and I think going forward with treatment, she's still early on, so we'll see how things go.
Brilliant. And so one of the frustrating things for me as a practitioner when I've sent patients to nutritionists for planning is that because the nutritionist is, usually a size 8 and eats really clean all the time and knows where to source everything, my poor patient who might be my age and have a really busy life would come out feeling like they had another job to do.
Mm-hmm.
And they'd be told to eat chia seed puddings, and they didn't even know what a chia seed was before the consultation, or super fancy new age type foods. And my patients would come away feeling bewildered and overwhelmed, and like they had another job to do. How is what you do different?
Yeah, so I think it's all about like taking that individualised approach and actually having that time to sit down with the patient. So we get them to fill out a diet diary before coming to see me, and then we'll sit down for a certain time going through that diet diary, but finding out about the foods that they are currently eating, and then then I can pick out the things that they are eating, and that if that works in with their the way that they should be eating, then we keep those in, and we just swap out the things that need to be swapped out. But it's all around. A lot of the introduction and the interview is about not so much what they're eating, but it's also about their lifestyle and the barriers that they're facing. So whether they do cook or their partner cooks. So it's about finding, what they're currently doing in their life and really fitting in with that. And also providing really easy to follow recipes and things like that as well.
Yeah. So if they're already eating green curry, you would swap out the rice for cauliflower rice, for example,
exactly.
Instead of giving them a whole new recipe.
Yeah, right. Exactly. Or looking at, your like zucchini noodles instead of like regular pasta, if that was something that they shouldn't be eating. So really just finding those easy alternatives for them. And patients are very compliant, but also are like, wow, that was so easy and I loved it. Those little changes. So there's a lot we can do.